Hello everyone, I'm Dr. Ansuman Matthew. I'm a registered pharmacist. Today is May 8th, and May 8th is observed annually as the World Thalassemia Day. It is a worldwide campaign to raise awareness about thalassemia and its symptoms. This is done to help the patients living with this genetic disorder. World Thalassemia Day commemorates thalassemia victims and also aims at making thalassemia patients aware about the significance of medical consultation before marriage. So let's discuss on thalassemia briefly. So what is thalassemia? It is a genetic blood disorder that significantly reduces your hemoglobin count. So let us understand more by breaking that statement. It is a genetic disorder. So what is genetics? It is a genetic disorder, meaning it has been inherited or it is like transferred from the parents to their children. So it is a genetic blood disorder. So everyone knows what is blood, right? And what happens is that there is significantly reduction in your hemoglobin count. So what is this hemoglobin? Hemoglobin is a protein molecule which is present in our red blood cells. So as we all know, in our blood we have mainly three groups of cells. First one is the red blood cells, which is abbreviated as the RBCs. Second one is the white blood cells, abbreviated as WBCs, and third one is the platelets. So red blood cells, like they are red in color, it is due to this pigment called as hemoglobin. What is the function of these red blood cells? They help in transferring oxygen. Second one I have told is the white blood cells. These plays major role in protection against all the infections and all. And the third one is the platelets. That is they help in blood clotting and all. So these are the major three groups of cells which are found in our blood. So here we have to focus on the red blood cells. So what happens is that in thalassemia, there is a significant reduction in hemoglobin. It helps the RBCs in carrying oxygen and circulating it in the entire body. So what causes thalassemia? So we have already learned that it is a genetic condition. So thalassemia is caused by the mutations in the DNA of the cells that make hemoglobin. And hemoglobin is a protein in our red blood cells that carry oxygen throughout our body. And the mutations associated with thalassemia are transferred from parents to their children. Now, hemoglobin molecules are made up of chains called as alpha and beta chains, which are affected by these mutations. So, in thalassemia, the production of either the alpha or beta chain are reduced, resulting in alpha thalassemia or beta thalassemia. So, what are the symptoms of thalassemia? It includes anemia, due to which the patient may experience drowsiness, fatigue, chest pain, shortness of breath, headaches, jaundice and pale skin, dizziness or faintness, delayed growth, and greater susceptibility to infections. So, what are the risk factors for thalassemia? It includes family history of thalassemia, as thalassemia is passed from parents to children through the mutated hemoglobin genes. So if there is any family history of thalassemia, then there is a risk that you can get thalassemia. So how is thalassemia managed? Thalassemia has no known cure, but the treatment involves blood transfusion, bone marrow transplantation, and gene therapy. So what are the complications associated with thalassemia? It includes iron overload. People with thalassemia can get too much iron in their bodies either from the disease or from frequent blood transfusions. Too much iron can result in damage to your heart, liver, and our endocrine system, which includes the hormone producing glands which regulates the body processes. Next one is infection. People with thalassemia have an increased risk of infection, and this is especially true if your spleen is removed. And the other complications include bone deformities, enlarged spleen, slow growth rate, and heart problems. So the theme for World Thalassemia Day 2020 is the dawning of a new era for thalassemia. Time for a global effort to make novel therapies accessible and affordable to patients. India is known as the thalassemia capital of the world with 40 million carriers, which means that 1 in 8 of thalassemia carriers live in India. Over 1 lakh patients across the country lose their life to the disease before they turn 20 due to the lack of access of treatment. Every year, 10,000 children with thalassemia major are born in India, which approximately accounts for 10% of the total world incidence of thalassemia. There is a lot more to discuss on thalassemia, but this is a short video to create an awareness on thalassemia. That's all. Thank you for listening.